Okay, this is gonna sound weird, but it's not a sexy subject. Okay, talking about glove fit. If your gloves don't fit, so I don't know, change your brand or something. But the thing is that if you have a small hand like me, it's probable that most of the brands don't really have a very well-fitting glove. Hello, my name is Sanna Kouhia. I'm a surgeon and I reside in Finland. My daily job, the ones I do during normal office hours, would mostly be venous surgery. So very, very light office-based surgery, a lot of outpatient procedures. And then, well, some people call it a hobby. I call it a second job, is organ transplantation surgery in the abdominal area. So we're talking about liver transplantation, kidney transplantation, and pancreas transplantation. So two very different fields of surgery that also require different kinds of equipment, including gloves. A good fitting glove is the one that I can actually forget that it exists. It's just like a continuum of the hand, instead of being like a separate thing on your hand, if that makes any sense. On the contrary, if you have a poor fitting glove, it's kind of a barrier, not in a positive, like aseptic sense of being a barrier between you and the patient and potential diseases or bacteria or whatever. It's a barrier between you being effective in your work. Patient safety and glove fit, I think, definitely go together. If your glove is not from the fingers fitting properly, you're much more likely to get a perforation to the finger part of your glove, which basically means a contamination. We are operating in gloves that were designed for, unfortunately, for males in 1990s or 1980s even, thinking that everyone should wear gloves that are designed for men when we have maybe 50% of surgeons as female and, quite frankly, maybe 90% of scrub nurses as female, actually makes zero sense. Are these really the tools which will allow our personnel, which is, by the way, the most expensive part of healthcare, allow our personnel to work as effectively as possible? I would say all our tools are equally important. It doesn't matter if it's an expensive tool or a cheap tool. Everything is equally important. Everything builds up to good patient care.